Good afternoon, everyone present here. I am Faraz from IGCP Group. Welcome all the participant on today's webinar. That is on a very important topic. As we know that vitiligo has become very common nowadays. Like lots of people suffer from this disease, but they don't have the proper understanding. So we are coming up with this webinar today. As we know that today is a very important day, and that is related to World Vitiligo Day. And so today we will discuss about common myths, facts about vitiligo. And so for this topic, we need someone who is expert and someone who has very much knowledge about this topic and can be deliver excellent talk and will discuss about myths and fact about it. So I would like to invite today's guest. He is Dr. Anil Ganju sir, and let me share some of the achievement of sir. Sir has done MBBS, MD in dermatology, venerology, and leprosy, and director of Skin Vocation Clinic, the World of Aesthetics, Model Town, New Delhi. Presently, president of SAARC AAD. By taking not much time, I would like to invite sir and hand over this session to sir. Sir, the stage is yours. You can start with the context of this topic.
Okay, thank you, Faraz, for those kind words. And good afternoon, friends. It's a pleasure to connect with all of you today. And my greetings to all of you. So, we are going to talk about a very important and difficult and distressing disease called vitiligo. But there are a number of misconceptions about this disease that we are going to try and clear out. Let me tell you at the outset that vitiligo is just a cosmetic disease. It does not go beyond the skin, it is only in the skin. It is not an infective condition, does not spread to others. So if somebody with vitiligo touches another person, the other person does not get the disease. It's basically genetically mediated. So it happens in a person who has genetic predisposition to the disease, and then certain environmental factors like UV radiation, irritants, like pollution, like viral infections, anything can start the disease process, and because of which there is an autoimmune process happening in the body that leads to destruction of the color forming cells in the skin. They are known as melanocytes. Once the melanocytes are destroyed, the patient will present with these white patches on the surface of the skin. And beyond that, there is nothing else happening in the body. So, this disease is absolutely cosmetic. It is just that the patient will have some patches of white color on the skin. And about the treatment, let me tell you, we have wonderful treatments coming up, and we already have very good treatments for this disease. Although, like any other genetic disease, like be it blood pressure, diabetes, or any other genetic disease, you generally do not have a cure for the disease in whatever form of medicine you may say, allopathy, ayurvedic, etc. There's no cure for any of the genetic disorders. But likewise, since vitiligo is a genetic disorder, you don't have cure, but there are a number of treatments. And once we stabilize the disease, we have surgical method of treating the leftover spots also. So there is a lot of hope for treatment for this disease. So patients do not have to panic and be in despair because of this disease. Go to a proper dermatologist and take your treatment. You're definitely going to benefit out of it.
Thank you so much, sir, for setting the context and giving the proper definition of this topic, that is vitiligo. I hope that this will be very much impactful to all the participants who have joined. So there are lots of common myths and facts related to this topic, sir. Today we are going to take the to the point practical questions which occur during the clinical practice, sir. The first question I would like to take is, sir, what is the current understanding of the pathogenesis of vitiligo? Is it autoimmune, genetic, or both, sir, as per you, sir?
It is multifactorial, and two of these processes are involved. So somebody who is born with a genetic predisposition to develop this disease will then have an autoimmune dysfunction, because of which is incited by a number of factors like environmental insults, UV radiation, viral infections, etc. So there is initiation of this autoimmune process where various autoimmune cells and various cytokines are involved in the body, and they induce the damage to the color forming cells in the skin. They're called the melanocytes. Once these melanocytes are damaged, they are unable to form the normal color, which is melanin, and because of which the patient develops the white patches. So it's a combination of so many factors.
Thank you so much, sir, for sharing all the your expertise on that question, sir. I hope it will be very much helpful. Sir, one of the most important question, I think there is a very difficult to understand, differentiate between vitiligo, sir. We will take this question, sir. How to we can differentiate vitiligo from other causes of hypopigmented or depigmented skin lesion clinically or dermoscopically, sir?
Okay, generally, depigmentation is a very hallmark of this disease. Most of the other conditions will have hypopigmentation. So one factor that differentiates vitiligo from other, lighter colors or whiter patches is the complete depigmentation in patients of vitiligo, because these patients have completely, damaged melanocytes, no color formed. So the skin is, the white patches are bright white. They particularly shine when you put ultraviolet light on them, so that helps us differentiate from the other hypopigmented patches. uh, on the visual examination also, we can make out a completely depigmented patch from a hypopigmented patch. And of course, dermoscopy helps us further. Dermoscopy is a newer diagnostic technique that we have, with which we can see the skin and slightly under the skin surface, very magnified picture of the structures that helps us find out what is happening in the skin. And it helps us particularly to find out the activity of the disease and the prognosis of the disease, whether it will respond to treatment. For example, if with the help of dermoscope you see pigmentation activity around the hair follicles, then that's a good sign. And because we will be able to stimulate that pigment to cover the rest of the skin. So dermoscopy helps us find out these patients who will have a good response to treatment. Or if dermoscopy shows that all the melanocytes and color around the hair follicles is gone, then that patient is likely less likely to respond. But that doesn't mean he has to lose hope. Such patients, we usually, if we are not sure whether the pigment will come back and the disease is stable for a good amount of time, 6 months to a year, then we take them up for surgery, where we bring melanocytes or melanocyte grafts from another part of the skin and put it here, from which the melanocytes spread into the skin. So this is how we differentiate, and this is how dermoscopy helps us in deciding the treatment and prognosis of the patient.
Thank you so much, sir, for sharing your expertise on that question, sir. I again hope it will be very much impactful to all the audience who have joined this webinar, sir. One of the very important questions, sir. As we know that, sir, you have lots of expertise in the field of dermatology, and you have been you have seen lots of patients who are suffering from vitiligo. So the one question arises is very important, sir, to all the PG students who are doing their dermatology or the practitioners who are doing dermatology, sir. So the question arises, sir, what are the common myths and misconceptions about vitiligo you encountered during your practice, sir? Can you please share some point on that?
Okay, so as I told in the beginning remark, lots of patients think that this is an infective and a communicable disease, and they do not, mix with these patients. They do not touch these patients, and they feel that they'll get this disease, or they don't have food with them. They don't share food with them, which is all a myth. It does not spread by touching, by having food together, because it is not an infective condition. It's a genetic disorder. Also, there's a myth that allopathy cannot treat this condition, and the alternative forms of treatment has a treatment for this condition. It's the same in all forms of treatment. This is a genetic disorder. A patient will get relief from the disease. We can treat the patches, but there is always a likelihood of the patches coming back, which can happen with any form of therapy, be it allopathy, be it ayurvedic, be it homeopathy. But you can control the disease. There is hope for control of disease, bringing back the pigment. And if there are patches where pigment can't come back because there is total destruction of the melanocytes, we can't have nothing to stimulate in the skin, then we resort to surgery also. So not only are we equipped well with treatment of the active disease initially, but also once the disease has gone out of control, in the sense that there's no pigment left, there are no melanocytes left that can be stimulated, we can now treat it surgically by grafting the melanocytes into the depigmented area. So these myths have to be given up. The patient has to, not to panic. and once they see this disease, they go to a dermatologist and they'll get proper care. If a good dermatologist treats vitiligo, most of the patients can be treated very, very well.
Thank you so much, sir, for sharing again expertise on that question, sir. A very important question arises, sir. Like as we discuss about the misconception and myths, sir, during the practice, sir. As we know that, sir, during the OPD, lots of patients come who is suffering from vitiligo, and it's very important, sir. One question arises, sir. As the patients come, sir, they have very low self-esteem, sir. They feel not more social, sir. How to deal these kind of patients, sir? What will be your approach? Your
So,
words for all the practitioners.
they need a lot of counseling. You have to talk to the patient. You have to sit down and explain the disease, the nature of the disease. Tell them that it's not an infective condition. Build their confidence and tell them that it's just a cosmetic problem. Somebody may have a burn on the face. Some may have a scar on the face. You have just a loss of pigment on the face. So, if the patient understands that it's just a cosmetic problem and he's able to deal with it better, and sometimes we can also give them some camouflage to cover up the patches which are visible, so that they do not feel embarrassed in the general society. It is important to spread the awareness not only to the patient but to the patient's family, in nears and dears, and also to the society at large, about the benign nature of the disease, about the non-infective nature of the disease, non-communicable nature of the disease, and the simple cosmetic nature of the disease. So once you are able to tell the patient and the family about the nature of the disease, most of them take it well.
Very well said, sir. As we know that, sir, like self motivation is very much important. If you are suffering from this kind of disease, if you are motivated, then there is no thing like it is better. It will get better when you have the positive aspects. Moving forward, sir, we have another question, sir. As we know that when we see the symptoms, then the role of biomarkers and imaging techniques comes, sir. This question is related to that, sir. Are there any biomarkers or imaging technique being developed to track disease activity or progression in vitiligo, sir?
Generally, most of the follow up, most of the diagnosis, treatment, etc., is done clinically only. In vitiligo, we do not follow too much of biomarkers, but there are experimental biomarkers that have been tracked in patients who have active disease. For example, in their peripheral blood, they may have raised levels of certain cytokines like interleukin 1 beta, like interleukin 17, interferon gamma, certain chemokines like CXCL9 and 10. So these are available as markers in the blood which tell us that the disease is active. But generally, practically speaking, we do not do these because they are not easily available, and if at all, they may be expensive. And we are able to deal with the disease clinically very well, the progression of the disease very well. So generally, we don't resort to this, but they are mentioned, and this is generally more for research rather than for practice.
Thank you so much, sir, for sharing this biomarkers and imaging techniques points, sir. So moving forward, like as we move forward, like to treat the disease, sir, the role of therapy comes, sir. We will discuss really one question related to that, sir. Like lots of therapies are available, sir. Sir, according to you, sir, how do you decide between tropical therapy, phototherapy, or systematic immunomodulators for new patients, sir? Could you please share some insight on that?
Okay, when the patient comes in, depending upon the severity and the extent of disease, you decide the therapy you are going to do. For example, a patient has 3 or 4 localized patches, then we would give them topical therapy and the ultraviolet light. So, topical therapy consists of topical steroids, topical calcineurin inhibitors, topical JAK inhibitors. All these help us control the disease locally, and the ultraviolet B light, or sometimes we give them Sorolin application and sunlight exposure that induces the pigment and brings back the pigment. So this is the treatment for a localized disease. Once the disease is widespread, involving more than 15 to 20% of the body surface area and is spreading, unstable, then we usually have to resort to a systemic therapy with immunomodulators, and generally steroids are the first choice. But we don't give steroids for a long time. So we start with steroids and then ultimately go to some other immunomodulators and immunosuppressives like azathioprine, like methotrexate, they can be given long for a longer period with not much side effects compared to steroids. So these immunomodulators are generally given for patients who have more widespread disease and unstable disease. But as soon as the disease becomes gets under control and gets localized, becomes stable, then we try and go on to the topical treatment only.
Thank you so much, sir, for sharing your expertise related to that therapies, sir. I hope it will be very much impactful. I can see, sir, couple of feedback from Dr. Anshuman. He has written very important topic. Thanks for taking it in a podcast way. And one more from Dr. Subramanian. He has written a nice topic and thanks for taking it up. So two feedback I can see from the two of the participants, sir. I would like thanks to them for joining. And moving forward, sir, we are taking another question, sir. Sir, what's your experience with narrow band UVB and NB-UVB therapy, and how effective is it is across different types of vitiligo, sir?
Okay, as I told you that the disease has two components as far as the therapy is concerned. One is treatment of the active disease. We give them systemic drugs, topical drugs, whatever, to control the autoimmune process. The other is then inducing the melanocytes, whatever leftover melanocytes are there, inducing them into further activity so that they can proliferate and produce the pigment and spread the pigment into the depigmented area. For the stimulation of the melanocytes into activity, we generally use the narrowband UVB therapy, or we can even use the PUA therapy, local and topical and oral. But now, generally, we have moved on to the narrowband UVB therapy because that's considered to be safer. It is also available as a targeted therapy now, which becomes very easy to administer for smaller patches and is much stronger. So it's a very, very useful and important part of your treatment as far as the vitiligo goes. Once you have controlled the disease, the bringing back of pigment is dependent upon exposure to ultraviolet light. So be it a full body chamber, a local chamber, or a targeted therapy, all of them are very crucial in bringing back the pigment in the depigmented area. So I use a lot of narrowband UVB therapy, the full body localized and the targeted excimer lights. They all help in bringing back the pigment in the depigmented patches.
Thank you once again, sir, for answering that question, sir. As sir, we discussed about social aspects, sir. You used one word, sir, that is camouflage, sir. We will discuss related to that, sir. What advice do you give patient regarding cosmetic camouflage, skin care, and sun exposure, that is sun protection, sir?
So many patients are really embarrassed because of the multicolored nature of the condition they have. If the important parts, exposed parts of the body like the face, the hands, neck, etc., are involved, so generally they feel embarrassed when they are going out for their social activity, because there is a stigma associated with the disease. The patients do not want to show their disease, so then we give them camouflage creams. These are very easily available, and they are resistant to sweating, washing, etc., to a good amount of extent. But generally, you can't wash it off though. But if it is applied in the morning, it can last you for some few hours if you have not sweated too much or if you have not washed it. So, camouflage creams go a long way in improving the confidence of the patient and improving the interaction of the patient with the society and not feeling embarrassed about the disease until we are treating the disease and we have gotten rid of the white patches. So until then, camouflage we add to many patients because they may have a lot of interaction. Their jobs may involve interaction with people. So camouflage goes a long way to improve the confidence of such patients. And as far as
Thank
skin care, sun protection is concerned, these patients, because they have lost the pigment in those areas, they are prone to further sun damage and sun burns because of exposure to sun. So generally, and then sun can also induce further activity of the disease. So generally, we try and avoid sun exposure and we give them good sunscreens for the exposed areas. Although sun is also used for the treatment, which I told you, sometimes we give We give local sorolins and expose to sun, but only for a short period of time when we need to. Otherwise, the sun exposure has to be avoided. We use sunscreens to protect their skins from sun damage.
Thank you so much, sir. Very well explained, sir, and important points are shared. I hope that lots of myths and the misconceptions people are having related to vitiligo are going to be cleared through this topic, sir. And moving forward, sir, like as we know that lots of advancement are coming in the field of dermatology, in the field of medical, sir. And as we know that a lot of future therapies are also coming, sir. I would like to ask one question related to that, sir. What do you see as the most promising future therapies for vitiligo, sir? Can you please share your opinion on that?
So most of the autoimmune conditions now, there's a class of drugs known as the JAK inhibitors. The JAK inhibitors basically have a very multi-pronged effect on the autoimmune process. They affect several aspects of the autoimmune activity and suppress autoimmune activity at several levels where lots of cytokines are involved. So they affect most of the cytokines. So they have become quite, talk of the town types and useful in most of the autoimmune conditions. So are they useful in vitiligo also. So we have certain oral drugs like tofacitinib and baricitinib available now, which can give us quite good results. And a topical JAK inhibitor called ruxolitinib has become available outside our country now. It's going to come to our country soon. It has shown extremely promising results and local application only, no side effects, and very good outcomes have been seen with this drug. So I see good future in these therapies. We hope to have ruxolitinib soon in our country. That's really going to help us mitigate the problems associated with this disease.
Thank you so much, sir, again for sharing your expertise on that question, sir. Moving forward, sir, we will take a couple of more questions for today's session, sir. And another question is, sir, how close we are to achieve true repigmentation or even a potential cure, sir? What's your point of view on that, sir?
So repigmentation we achieve. Cure we will achieve only when we can intervene or interfere with the genetic makeup of the patient. So gene therapies are being studied. So once we are successful in changing the genetic makeup of the patient and treating the genetic defect in the patient which causes the disease, then only would be able to cure. This is true for all the genetic disorders, be it hypertension, diabetes, all these thyroid. So all these diseases can't be cured as on now. So if somebody claims that we can cure any of the autoimmune diseases, that is an absolute myth. So we can only treat them once the gene, there is any breakthrough in gene therapy which helps us treat the genetic defect in the patient, maybe while the patient is in the womb or at the time of conception, etc. But as on now, we don't have any means to cure the disease. But repigmentation, yes, we achieve full repigmentation, and whatever is left we treat it with surgery, and that also brings back the pigment completely. But the possibility of it coming back is always there.
Thank you so much, sir, for answering this question once again and clearing one of the biggest myth, that is that curing it permanently. Like lots of people are there, like lots of which give assurity that we will cure it permanently. That is also a myth, sir. Thank you so much, sir, for taking this in point out. Sir, one last question I would like to take, sir, related to this topic, sir. What role could regenerative medicine or gene therapy play in future of vitiligo care, sir? What's your point of view on that? This
So
question,
I
sir.
already told you there's a lot of research happening in the field of genetic therapy. We hope and foresee that if the gene therapy reaches such success that it can correct the genetic defect which is involved in producing this disease, then we may have a breakthrough in getting a cure for this disease, and not only for this, but for so many other genetic disorders that we come across. So we don't have cure for any of the genetic diseases, But if gene therapy reaches a point of success to the extent that it corrects the genetic defects in these diseases, then probably yes, we will be able to cure them.
Thank you so much, sir, for answering this one too. I hope, sir, you have done justice to this topic by clearing common myths and facts related to this topic on the occasion of World Vitiligo Day. Sir, one last, sir, will be your final take-home message for the all the audience, the upcoming PG dermatologists who are going to become future doctors of our nation like India, sir? What will be the take-home message to all of them, sir, from your end?
So the take home for the patients and the society at large is that please treat this disease as a simple cosmetic problem, and make sure that you go to your dermatologist and get it treated. There's a lot of hope about most of the patients get treatment, get repigmentation. They may have a chance to get it again, but that doesn't mean that there is no treatment. As I said, that leftover patches can be treated with surgery, and there's hope for those also who do not respond to treatment. For the young dermatologists, I would want them, to be very empathetic about this disease, these patients, talk to them properly, counsel them properly, spread the message that this disease is a very benign disease. It is just a cosmetic defect and is treatable, and give hope to your patients.
Thank you so much, sir, for this amazing take-home message, sir. And with this, I am concluding this webinar for today's. And we would like to see you in future also with different topics, sir. It was great honor to have you, and it was great honor to host you, sir, too. And we would like to see you in future also. Till then, take care of yourself, sir. Thank you.
Thank you very much, for